Lights, camera, action. Mark Sweeney here from Austin Dental Spa in beautiful, hot Austin, Texas. If you tuned in last week, then you know what the lights, camera, action was all about. Our motto for the month of August is Action August. And so we got a little prop action going here just to drive home our point. We're going to have some fun with this topic all month. Today's going to be no difference. We're going to talk about the pros and cons of a mysterious habit for a lot of people called oil pulling, and exactly what it is and how it might benefit you, and some possible cons of oil pulling. But before that, like I've said, this is Action August, and we're going to talk about other ways to swish, spit, and repeat. And that's what the New York Times said recently about oil pulling. Now, being here in Austin, I've heard the term oil pulling and have dozens of patients that have either tried it or continue to use it on a regular basis for over 20 years, maybe even a little longer than that. But what's popped this back up to the top of the food chain again is TikTok. I get TikTok videos sent to me regularly, mostly by my 30-something-year-old daughter, but and my 20-something-year-old sons. But if you're familiar with TikTok, they're little quick videos, and people are becoming influencers, I think is the term they use, and they're becoming famous overnight by going viral on TikTok. And somebody posted a TikTok video about oil pulling, like for the new generation that are the TikTokers. It's a whole new concept. And so what they were promoting is anywhere from 5 up to 20 minutes. And they had various different oils that they mentioned in there. So the main ones that I've heard patients using is coconut oil, olive oil, lavender oil, sunseed oil, and sesame oil. Those are the ones I've heard about. The vast majority of my patients use either coconut oil or lavender oil. I can't imagine holding my lavender oil in my mouth for 20 minutes, not even 5, I wouldn't think. Most of my patients say they hold it in for 1 minute or maybe up to 2 or 3 minutes. But what does it possibly do for you? And some of my more oil pulling patients say the different oils do different things. So they specifically aim it at some ailment in their body that they feel like they're trying to correct. There are several theories of how this works. The mouth is fairly absorbent, so if you've ever, if you're having a heart attack, the EMS guys put nitroglycerin tablets under your tongue because there's a very thin tissue down there. When we've got a sedated patient here in the office and they start waking up a little bit and we've got another hour to work, and they're numb in their mouth, we can't have them sit up and swallow another pill because they can't tell and they're still kind of sedated. We crush up the tablet and pour it underneath their tongue and just let their tongue sit on top of it. Within typically 3 to 5 minutes, it's been absorbed. Those little gritty pieces of the gravel of the tablet, and so things do get absorbed readily in the mouth. And so some of that is going to get into your system of whatever kind of oil that you're holding in your mouth. Most of these oils do contain antioxidants, which have long been known to fight the free radicals that happen in our bodies as there's cell damage, and are known to be a potential cause of cancer, precancerous issues anyway. But there is a dentist quoted in the article from the New York Times Dr. Deborah Foyle, who's a periodontist at Texas A&M University Dental School right up the road in Dallas, used to be Baylor College of Dentistry. She was quoted in the article as saying that that it could slow the growth and reduce gum inflammation, but that there's no scientific evidence. That is the American Dental Association's view on oil pulling as well. They're just kind of standing on the sidelines and saying there's no positive evidence that it does you some good, but there's also no evidence that shows that it does you any harm. The patients I have that have used it for a long time, they're absolutely convinced in their minds that it's having a positive effect. There are things out there on the internet that claim that oil pulling can remove gum disease, even in the latter stages, periodontal disease. It won't make bone grow back, I can guarantee you that, but it might kill some of the bacteria depending on which oil you're using. I have heard people say that it whitens your teeth. I have not seen any evidence with my own eyes that, or any empirical studies on the internet or in the dental literature that show that any of those oils cause any kind of whitening situation in your mouth. Last week we talked about charcoal toothpaste and how they were promoted as whitening your teeth. If you want to know more about that, we are archived on Facebook and YouTube, and you can go back and watch last week's article about charcoal and several other things that are not so good to be using in the mouth. The American Dental Association, as I said, says there's no reliable scientific studies to show that oil pulling reduces cavities, whitens teeth, or improves oral health. But according to the periodontist from the Texas A&M Dental School in Dallas, there's no evidence that it causes any harm either. So the only risks I can see with it is that holding it in your mouth, the longer you hold it there, some of it's going to go down the tube and into your stomach through your esophagus. And if it's an oil that, like peppermint oil or something, potentially even sesame seed oil, could potentially cause an upset stomach, just like anything else you put in your mouth or swallow that may be an issue. Aside from effects on your body, there was also evidence in this article that most people spit the oil into the sink after they've held it in their mouth for however long they're going to do it. And they threw in the article that it potentially could clog your sink up and cause damage. And I'm not a plumber. I don't know that much about all that. But another restorative dentist at Penn Dental Medicine noted that 5 to 20 minutes is a lot of time to spend swishing oil around in your mouth when spending that same amount of time doing a good job brushing and flossing might do you more good, and has been proven over and over to lead to a healthier mouth. So he had a point there, but he's kind of missing the point. We're talking about oil pulling, not, hey, you could spend that same time and do a better job of brushing. The oil pullers out there don't want to hear that. They want to hear that what they're doing is really doing a good job. And apparently there's something called oil pushing, which is like forcefully swishing it around, and there is no evidence that that helps any way, and so I wouldn't really recommend doing that. The typical patients that I've heard, they just hold it in their mouth for a period of time, and like I said, most of them, it's coconut oil or lavender seed oil, and they come in to get their teeth cleaned. I don't see major accumulations of anything in their mouth. They typically are people that take pretty good care of themselves anyway, or they wouldn't be into that kind of stuff. And so their mouths are usually very healthy, but they're convinced that the oil pulling is part of their success formula. I'm not gonna not gonna rain on their parade. So hopefully that's been interesting information for you. Certainly was for me to revisit that and do a little research into it. As you know, I always have a health tip of the week, and since it's mid-August, even though school's back in session, the swimming pools are still open. And so I figured we'd do a little quickie on what to do if you get swimmer's ear. We probably all had it if you spend enough time in the pool. I'm a scuba diver, so in my scuba kit that I take on the boat, I carry the swimmer's ear stuff, because you're down underwater for 20 to 40 minutes, and if you don't do something about that ocean water in your ears, you're going to get swimmer's ear, which is an infection that happens on the outer ear canal where things get clogged up. And actually, this is one of the times that wax in your ears might not be a bad thing. Don't clean your ears out right before you go swimming or diving, because more water potentially could get in there. But if you get it in there, if you dry your ears, you know, we all, when we were kids, would shake our heads like that with the towel on the other side, and all of a sudden you'd hear that, and the water would come out and you could hear again. This quick, easy way, in my suggestion, is buy some of that swimmer's ear. It's like less than $5. It's basically just alcohol and water, and you turn your head, pour a couple of drops in there. You'll feel it. The alcohol gets down underneath the water and raises the water up because it's heavier molar weight. And then when you turn your head, it all comes out, and your ears actually feel a little cleaner too. So that's my health tip for the week. If you are a major swimmer, or if you're a diver, get some swimmer's ear. I think that's what it's called now. They probably got multiple different terminologies for it, but it's in that section of the pharmacy. The pharmacist can point you exactly where to get it. So if you're having earaches after swimming all summer, treat it with that. Otherwise, I will see you next week for another episode of Wisdom Wednesday.